What is CDSS and why is it needed? CDSS is a medical software that helps doctors make better decisions about their patients.
First, do no harm is the most fundamental principle of any healthcare service. However, medication-related harm affects nearly 1 out of every 30 patients in the healthcare, while 5 to 20% of all physician-patient encounters suffer from diagnostic errors. Some of these challenges in the modern healthcare settings, such as diagnostic errors, treatment delays, and data overload, etc., can be effectively solved by a clinical decision support system, or CDSS for short. Consider the case of a patient with symptoms of chest pain, mistakenly diagnosed as having acid reflux, who later suffered a heart attack. This misdiagnosis, attributable to the clinician's oversight of the patient's family history, is easily avoidable with an integrated CDSS. 2. Treatment delays. A patient with an unusual presentation of cancer might experience critical delays in starting a treatment because the initial symptoms may have been mistakenly attributed to some other common or less severe conditions. An AI-driven CDSS, on the other hand, analyzes the symptom subtleties and patient data to suggest prioritizing specific diagnostic tests, potentially speeding up the correct diagnosis and commencement of treatment. 3. Data overload. Consider a scenario in a busy urban clinic where a physician must quickly decide on the best treatment course for a diabetic patient with multiple comorbidities. The physician needs to consider an array of complex factors, including the recent clinical guidelines, drug interactions, and individual patient history. A CDSS integrated into the EHR in such scenarios presents tailored treatment options based on the latest research and a holistic view of the patient's unique health profile, thus reducing the cognitive burden on the doctor and enhancing the decision accuracy and better outcome for the patient. These challenges underscore the critical need for an integrated CDSS in an EHR system. And in the following, I am going to demonstrate how these challenges are effectively resolved by our implementation.